We are back now with neurologist Dr. Leah Croll, and she is looking at some questions from you guys. This one is from Joy K. Why can't I get certain songs out of my head? How can I train my brain to forget them?
And that happens when I go to sleep, I swear. It's like a song that's on repeat.
It's always a song you don't
there.
want in your head.
Taylor Swift, Shake It Off has been in my head all morning, you guys. So this is called an earworm phenomenon, and essentially it relates to the way the brain processes music, which is so interesting because it involves the emotional and memory centers in the brain. And so there are a few things that may make you more likely to get a song stuck in your head. One is if the tempo is really fast, or if it has a lot of long, sustained notes. Also, if you have an emotional connection to the song. And then, of course, if it's a song you're hearing frequently. Now, in terms of what you can do about it, you're going to have to try on a few different strategies, and here's some ideas for you. Some people say just scratch that cognitive itch, listen to the song in full, see if that relieves the pressure. Some people say try and distract the brain by listening to other songs, see if you can replace it with a different song. You can try engaging in activities that won't allow your mind to wander so much, so maybe doing a puzzle, reading a really good book, not giving yourself that mental space to have something stuck in your head. And then if all else fails, there is a study out there that suggests that chewing gum is actually very effective for stopping this.
All right, we'll have to try those. Here's another question from one of our viewers, Chrissy M. She says, I'm really nervous to get an MRI. What can I expect and what can I do to make it less uncomfortable?
You are not alone in having fear about that. MRIs are scary. It's a really loud machine, and it's also a very confined, small space that you're in. So many patients are very anxious about this, understandably so. There's a few things you can do to make it a little more comfortable for yourself. I always say wear comfortable, loose-fitting clothing. Bring earplugs that are going to be comfortable for you. When you get to the MRI facility, ask them what resources they can offer. Many will have noise-canceling headphones or weighted blankets. I strongly encourage my patients to keep their eyes closed the entire time that they're in the machine, focus on themselves, on their breaths as much as they can, and less on the machine around them. Remember, it's dangerous to bring your phone in there, so at least enjoy that time where you're unplugged and unbothered. And then finally, if you're someone who has a history of really serious reactions to MRIs or severe claustrophobia, talk about it with your doctor beforehand.
I like that focusing on breathing, just breathe. All right, Doc, thank you very much.
Coming from the man who added an optional one.
And didn't need it, but I use all of my insurance, all my benefits. Folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions at ABCGMA3.